I'm going to read a little bit more of The Sum of Us, and this part is about healthcare in rural communities. So I'm going to start towards the bottom where it says rural America. Rural America is experiencing a quiet crisis. Rural hospitals account for 1 in 7 jobs in their areas, but over the past 10 years, 120 hospitals have closed, dealing a body blow to the economy and the health of the country's mostly white, overwhelmingly conservative communities. A quarter of the remaining rural hospitals are at risk of closing. One thing that all of the states with the highest hospital closures have in common is that their legislatures have all refused to expand Medicaid under Obamacare. Texas leads the country in rural hospital closures, with 26 hospitals permanently closing or whittling down services since 2010. The state has half of the hospitals it had in 1960. In 2013, an 18-month-old died after choking on a grape because her parents couldn't reach the nearest hospital in time. The outrage from that story swept the state. It was short-lived. What would reopen the hospitals, according to Don McBeth, an expert in rural medicine, who now does government relations for a Texas network of rural hospitals called Torch, is something that the powers that be in the state capital are dead set against, and that's Medicaid, both fully funding Texas' share and expanding eligibility for it, as Congress intended to with the Affordable Care Act. I'm going to start towards the bottom of this page. What the mostly white and male conservatives in the Texas legislature are doing to sabotage the state's healthcare system doesn't hurt them personally. The state provides their health insurance, but it's costing their state millions. Before Medicaid expansion, working class people had basically no option for health insurance. Most low-wage employers don't offer coverage, and buying it on your own costs an average of $4,000 a year for families. If you are under 65, this left only Medicaid, whose rules were mostly set by the states in another Southern congressional compromise, leading to an average income eligibility cap of just $85.32 for a family of 3, well below the minimum wage for one earner. If you lived in a Southern state, the likelihood of you being eligible was even lower. The cap for eligibility in Alabama is $3,900. Florida is $6,700. Georgia is $7,600. Mississippi is $5,600. And Texas is $3,700. If you make more than that, then you cannot qualify for Medicaid. So the fact that they didn't accept Medicaid expansion or Obamacare means that these people didn't have access to affordable health care. I do believe that this requires a part 2, and it'll come. Continuing my reading from The Sum of Us. Skip down towards the bottom. Expanding Medicaid should be a no-brainer for states cost-wise. The federal government paid 100% of the cost for the first few years and 90% into the future. The states that expanded saw hundreds of thousands of their working-class citizens go from being uninsured, where an accident can cause bankruptcy, and preventable illnesses can become fatal, to being able to afford to see a doctor. The benefits don't stop with individual people, though. Stable Medicaid funding has allowed rural medical clinics in expansion states to thrive financially. In Arkansas, the first southern state to accept expanded Medicaid, a health clinic in one of the poorest towns in the country has constructed a new building, created jobs, and served more patients, creating measurable improvements in the community's health. Now, why wouldn't a state's politician take free money to have such amazing health and economic outcomes in their communities, including rural ones with disproportionate conservative representation and fewer options for economic activity? It's not that it's unpopular. Expanding Medicaid has pulled higher than Obamacare since the bill passed. The answer is all too familiar: racism. Colleen M. Grogan and Sunnigan Ethan Park of the University of Chicago found that racialization affects state Medicaid decision-making. First, they found that just after the Supreme Court decision that made it optional, Medicaid expansion had robust support among Black and Latino Americans at 82 and 65% respectively, but slightly below majority support among white Americans at 46%. Across the country, state-level support for Medicaid expansion ranged between 45 and 55%. Interestingly, some of the highest support was found in the South, where a larger black population drove up the average. So basically, a lot of these southern states are just saying no, 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 because black and Latino people would get a piece of that pie too. And for whatever reason, Alabaster folks don't feel like the darker hued people should be able to enjoy healthcare benefits. So even if they get none and don't get to enjoy the benefits of having a hospital, at least black and brown people don't get to do it either. So that is a reading from The Sum of Us. This book is definitely eye-opening. So you guys jump in the comment section. Tell me what you think. Like, comment, share.